Hello, I am Dr. Somasekhar, gastroenterologist and hepatologist at Apollo Hospitals, Hyderabad. I have been working in gastroenterology for the last 8 years, and the most common cause, which was what I felt was people are not aware, was about hepatitis B and hepatitis C viruses. So I thought I will talk to you about these viruses in short. So basically, there are two chronic hepatitis viruses, hepatitis B and hepatitis C. We can talk about them together because they have similar symptoms most of the time and similar modes of transmission. So these viruses, when they infect human body, they doesn't harm any other organs of the body except the liver. And these viruses are hepatotropic viruses, and these damage the virus. They stay in the liver and they damage the liver. So the damage caused by these viruses can be detrimental, that it can cause cirrhosis of liver and hepatocellular carcinoma, like if you say liver cancer. So all these things are avoidable when we know about these viruses and when we can treat them adequately at right time. So most of the time, if you do a simple test called HBsAg, we will be able to detect the virus called hepatitis B. And if you do a test called anti-HCV, we are able to detect a virus called hepatitis C. So when we detect these viruses, based on the patient's other parameters like the liver function test, we will decide whether the patient needs treatment, and if the patient needs treatment, there are good drugs available for hepatitis B and hepatitis C which can cure the disease. So if we treat the virus, there is no chance of liver damage like cirrhosis or hepatocellular carcinoma. So the modes of transmission of these viruses are very important to know. Most of the time it's not just orophycal route or something like that, it's always intravenous. It can be transmitted by intravenous injections or needle sharing. It can be transmitted by blood products, blood and blood products. It can be transmitted by sexual transmission, and most of the time we see these IV drug abusers who are sharing needles and all those things. So all these things are chances of transmission. And one more most important route of transmission is mother to child. Mother to child transmission is also possibility in these viruses. So we should be aware of these viruses and the modes of transmission so that we can avoid the transmission of these viruses. So hepatitis B is a treatable disease whenever there is necessity, whenever the liver function tests are high or the hepatitis B viral load is high, we need to treat them. There are good antiviral tablets available for hepatitis B, and you are preventing liver from going into cirrhosis or hepatocellular carcinoma. Hepatitis C is a curable disease, and based on the hepatitis C RNA count and hepatitis C genotype, there are various drugs available in the market which are newly available, where the cure rates for hepatitis C, I am talking about cure rates of hepatitis C, are more than 90%. So I would suggest a simple blood test, one hepatitis B for hepatitis B HBsAg and one for hepatitis C the anti-HCV, can save your liver. If you are positive, you need to consult your doctor and get treated. You can contact me through Lybrate, or I am available in Apollo Hospital, Jubilee Hills, Hyderabad. Thank you.